Hello, I'm Dr. Emily. If you're over the age of 60, or you care for someone who is, this video may be one of the most important things you ever watch. That's because some of the medications you or your loved ones take every day, medications that seem safe, may actually be silently damaging the brain. Right now, nearly 55 million people around the world are living with dementia. Even more alarming, every 3 seconds, a new case is diagnosed. But here's what few people realize. Many of these cases are not caused just by aging or genetics. They're being triggered by medications, often prescribed by well-meaning doctors. I've had countless patients come to me complaining of forgetfulness, feeling foggy, tired, or simply not themselves anymore. Most of them thought it was just aging. But when I looked into the medications they were taking daily, I saw a clear pattern and a warning sign. Some of these medications are sold over the counter, some are prescribed by doctors. But what they all have in common is one thing. They interfere with the way your brain communicates. They may reduce important brain chemicals, cause confusion, forgetfulness, and over time, lead to permanent damage. 9. First-generation antihistamines, e.g., Benadryl. Many older adults take allergy pills like Benadryl for runny noses, sneezing, or even to help them fall asleep at night. But what many people don't realize is that these first-generation antihistamines, especially diphenhydramine, don't just stop allergies. They also block a chemical in your brain called acetylcholine, which is critical for memory, attention, and learning. In a major study, seniors who used these medications daily for 3 years had a 54% higher risk of developing dementia. That's not a small number, it's life-altering. You might begin by forgetting simple things, like where you left your glasses or your keys. But over time, these gaps in memory grow, until daily life becomes a struggle. I've seen patients who thought their forgetfulness was just aging, but when we removed the medication, their clarity returned. That's how powerful these drugs can be on the brain. 8. Benzodiazepines, e.g., Xanax, Ativan, Valium. Benzodiazepines are medications often prescribed to help people with anxiety, panic attacks, or sleep problems. Common names include Xanax, Ativan, and Valium. These pills work by calming the nervous system, but if used long-term, they can calm the brain too much. When the brain slows down too often, you start losing mental sharpness. Research has found that people who took benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. I once had a patient who was using Xanax to sleep for years. She couldn't understand why she felt foggy every morning or why she had trouble remembering conversations. Once we tapered her off the medication under medical supervision, her mental clarity started improving. 7. Proton pump inhibitors, e.g., omeprazole, Nexium. Heartburn and acid reflux can be painful, and drugs like omeprazole and Nexium bring relief. These are called proton pump inhibitors, PPIs. But here's the concern. Long-term use of PPIs blocks the body from absorbing vitamin B12 and magnesium, both of which are essential for brain function. One large study involving over 73,000 older adults found that long-term use of PPIs was linked to a 44% increased risk of dementia. Imagine your brain gradually losing nourishment, vitamins that protect neurons, prevent shrinkage, and support memory. When I review medications with my elderly patients, PPIs are often at the top of the list of concerns, especially when they've been on them for years without monitoring B12 levels. 6. Antipsychotics, e.g., Risperdal, Seroquel, Zyprexa. These drugs are often used to manage behavior in people with dementia or severe mood disorders. But here's a hard truth. Antipsychotics can actually make dementia symptoms worse. They blunt emotion, reduce responsiveness, and slow down thinking. The US FDA even placed a black box warning on these medications due to a significantly increased risk of death in elderly patients. I've worked with families who felt heartbroken watching their loved one go from being lively and expressive to emotionally flat and withdrawn, just days after starting these medications. 5. Z-drugs, e.g., Ambien, Sonata. Let's talk about sleep, a vital time for the brain to recharge and repair. Z-drugs like Ambien and Sonata are prescribed to help people fall asleep. But the sleep they induce isn't quite the same as natural sleep. These medications often suppress REM sleep, the deep phase where your brain sorts memories, clears toxins, and heals itself. Over time, Using Z drugs can leave you feeling groggy in the morning, and worse, it can impair memory, attention, and even increase the risk of falls and fractures in older adults. I've had elderly patients fall during the night, not realizing it was the sleeping pills affecting their balance and alertness. One patient came in after a minor fall, but what truly scared her was forgetting conversations she had the day before. 4. Tricyclic antidepressants, e.g., amitriptyline. Tricyclic antidepressants like amitriptyline have been around for decades. They're often prescribed not just for depression, but also for chronic pain, nerve pain, and migraines. But they come with a hidden cost. These medications also block acetylcholine, the same brain chemical affected by allergy pills, and when blocked, it can cause confusion, memory problems, and brain fog. Seniors are especially vulnerable to this effect. Research shows that the longer you take these drugs, the more your risk of cognitive decline increases. One study even found that long-term users had double the risk of dementia compared to non-users. I remember a patient who was taking amitriptyline for back pain. Over time, she began losing focus and having trouble remembering family events. We switched her to a safer option, and she noticed improvement within weeks. 3. Bladder control medications, e.g., oxybutynin. Dr. Emily. No one likes the embarrassment of bladder leaks. That's why many older adults turn to medications like oxybutynin for overactive bladder. But here's the catch. These medications also block acetylcholine, which we know is essential for brain health. Several brain imaging studies have shown that people using these drugs had smaller brain volumes, especially in the memory centers. That's right, these meds are linked to actual brain shrinkage. I had a patient who was becoming forgetful and couldn't understand why. When we reviewed her medications, oxybutynin stood out. After talking to her urologist and changing her treatment plan, her memory improved significantly. 2. Statins, e.g., Lipitor, Zocor. Statins like Lipitor or Zocor are among the most commonly prescribed medications in the world. They're fantastic for lowering cholesterol and reducing heart attack risk. But here's something most people don't hear. Your brain needs cholesterol too. Cholesterol plays a role in building brain cells and maintaining the connections between them. Some studies have shown that lower cholesterol in the brain may affect memory and cognition. If you're on statins and you're noticing mental fog or forgetfulness, talk to your doctor. Sometimes, adjusting the dose or switching to a different statin can make a difference. 1. Anticholinergic combination medications. This is the most alarming part of today's list. Some over-the-counter meds may seem harmless, but when they're combined, the danger multiplies. Cold medications, sleep aids, muscle relaxants. Many of these contain multiple anticholinergic ingredients. That means they block acetylcholine from several angles at once. When taken together, these combinations can lead to rapid cognitive decline, confusion, and memory loss. In a 10-year study of 3,400 seniors, those who used multiple anticholinergic drugs had a 54% higher risk of dementia. That's nearly identical to the risk from daily Benadryl use, but faster and more intense. I urge you, check your medicine cabinet. Look for anything with PM or sleep aid on the label, or anything used for colds or allergies. These may seem minor, but they can have major consequences for your brain. 3 foods that protect the brain. Now, for some good news. Even if you've used some of the medications I've mentioned, it's never too late to protect your brain. Let me share 3 powerful foods that science has proven to support brain health. Blueberries. These tiny fruits are packed with antioxidants that protect your brain from aging and damage. Studies show they may improve memory and delay mental decline. Fatty fish, salmon, sardines, and mackerel are rich in omega-3 fatty acids, essential for building brain cells and reducing inflammation. Leafy greens, spinach, kale, and collards are loaded with vitamin K, folate, and lutein. A long-term study found that people who ate greens daily had brains 11 years younger than those who didn't. So simple, right? Small choices today, huge impact tomorrow. If you or someone you love is currently taking any of these medications, please don't panic. The goal isn't fear, it's awareness. Talk to your doctor. Ask questions. There may be safer alternatives or ways to manage dosage. And while medications matter, so do your daily habits. Eat nourishing foods, move your body, sleep well, and stay connected with loved ones. Dementia doesn't happen overnight. It's a process. And that means we can take action, starting today. If this video helped you, please consider subscribing, leaving a comment, or sharing it with someone who might need this information. Let's protect our brains together.